the number one risk factor for death in the world is our diet. We overestimate the power of pills and procedures to actually keep us healthy. Almost every American raised on a standard American diet has heart disease. Right now, we are dying of diseases of excess nutrients, excess sodium, excess saturated fat, excess sugar. That's what's killing people now. Really, the ideal diet would be one exclusively centered around plants. And the more we can center our diets around these healthiest of healthy foods, the healthier we're going to be. And so the question we should all be asking from a nutritional standpoint these days is,
hi, everybody. I'm Emily Capodilupo. I'm the WHOOP Senior Vice President of Research, Algorithms, and Data. And today, I am joined by Dr. Michael Greger. There are so many reasons why I'm excited to be doing this with you today. Chief among them is that you're one of the most renowned nutritionists and plant-based dietary experts in the medical world. I think that's a great place to start, would be breaking down the science behind the benefits of plant-based diets.
it is not hard to be an expert on any kind of nutrition in the medical world since there's so little nutrition training. So the average medical student gets about 4 hours of nutrition training. Less than a quarter of medical schools have a single dedicated course of nutrition. So having an MD after your name is basically advertising the world that you know nothing about nutrition. You should never listen to anything any MD says about it, unless, of course, they've actually done studies. But otherwise, doctors are learning about nutrition like everybody learns about nutrition in the checkout aisle magazines or what some bro next to you at the gym tells you about. So unfortunately, it's it's not hard to be an expert in nutrition, but things are changing. We do have a new field of lifestyle medicine using diet and lifestyle interventions, not just prevent disease, but to arrest and treat disease. And so things are on the mend, but unfortunately, it doesn't take much to kind of rise above the fray. But in terms of what a healthy diet can do for you, I like to think of myself as an advocate of evidence-based nutrition, and the evidence just happens to point to eating a diet centered around the healthiest foods, which tend to be whole plant foods. And the benefits are, we can look to the Global Burden of Disease study, for example, the largest study on risk factors for death and disease in human history, funded by the Bill and Melinda Gates Foundation, found that the number one risk factor for death in the world is our diet. Number one killer in the United States is the American diet, bumping tobacco smoking to number two. Cigarettes only kill about 500,000 Americans every year, whereas our diet kills many more. The single most important thing we can do, the most important decision we make every day is, number one, what to put at the end of our fork. And that's because the number one killer for both men and women is heart disease, and most of our leading killers have to do with diet and lifestyle, which is good news because it means we have tremendous power over our health, destiny, and longevity, and that the vast majority of premature death and disability is preventable with a healthy enough diet and lifestyle.
I love that you went there because I think the first part of the message can come off a little intimidating, right? That like our diet is killing us. But I think it's really important that what people hear from that is your diet is one of the most in control things that there is, right? If you told me that the biggest determinant of health was my genetics, it's like, well, I either did a great job or messed up picking my parents, and that's the end of that. But tell me, so a couple questions before we keep going. You say plant-based diet, and I hear that language a lot. Is that vegetarianism or is that different?
No. So that is a diet that it prioritizes plants, not necessarily exclusively on plants. It is centering one's diet. A plant-based diet is an aspirational goal to include many of the healthiest of healthy foods in one's diet. And so that is, minimizing the intake of meat, dairy, eggs, salt, sugar, maximizing the intake of fruits, vegetables, legumes, such as beans, split peas, chickpeas, lentils, whole grains, nuts and seeds, mushrooms, herbs and spices, basically real food that grows out of the ground from fields, not factories. These are our healthiest choices. And the more we can center our diets around these healthiest of healthy foods, the healthier we're going to be.
And you keep saying healthiest of healthy foods. So within plant-based, what should our listeners be thinking about? Like, is it just enough to cut out meat, or what are the other things?
Oh my God. On? Well, look, some of the worst possible foods in our food supply are technically plant-based. Coca-Cola is plant-based. Potato chips, plant-based, right? These are some of the worst possible foods we can put into our mouths. And so that's why the proviso, unprocessed plant foods, or whole, WHOLE, whole foods, is critically important because you can eat an absolutely lousy junk food diet. I think Oreos are vegan.
Yeah, they're
I
vegan.
mean, so it's just like you could be like, now if you're doing it because you care about the climate or you care about some of these other, okay. But if we're talking about health here, then it's really about, these labels like vegetarian or vegan. As a physician, I mean, that just tells me what you don't eat. I mean, do you actually eat vegetables? And so that's really the critical component. It's what percentage of your diet is composed of whole plant foods versus everything else, which is the processed foods, which now make up about 60% of the American diet in terms of calories, as well as these animal foods.
So that's really helpful. And I love the framing around it being leaning towards, less consumption of animal products and not necessarily a rigid hard line. I think that's going to make it a lot more accessible.
And critically, what you're replacing them with,
Yeah.
right? That is the fundamental question in the field of nutrition, is compared to what? Or instead of what? Anytime someone asks you, are eggs healthy? You always have to follow up, compared to what? What else would you be eating instead of those eggs? If the answer is a breakfast link sausage, then absolutely eggs are healthy. If the alternative is oatmeal, then not even close are they healthy, right? But that's how, what about fish? What about anything? So what would you be eating instead of that food? And so it's not eat more of this, eat less of this. Public health messaging really has to be this instead of that. Not cut down on soda, but drink water instead of soda. That's a better kind of public health communication to make people make these actionable changes in their diet. And so, we started an app, Dr. Greger's Daily Dozen, which is kind of the dozen healthiest of healthy kind of foods and behaviors. I encourage people to fit into their daily routine. So yes, iceberg lettuce is a plant, but kale's even healthier. And so I want people to eat not just fruit every day, but berries every day. The healthiest fruits, not just vegetables, but dark green leafy vegetables, cruciferous vegetables, the cabbage family of vegetables every day, legumes every day, tablespoon of ground flaxseed, quarter teaspoon of turmeric, the best beverages, best sweeteners, how much exercise to get every day. Again, just try kind of inspire people to kind of follow along and have that accountability to keep them on the right path.
I love that framing. And I think that so often there's such a desire to say, like, this is the healthy pile and this is the unhealthy pile. And that oversimplifies things in a way that's just confusing and not helpful for people.
And it's all a spectrum.
Of course.
Right? So
logically, that's obvious.
Food is a zero-sum game. Every time we put something in our mouth, there's an opportunity cost. And that is failing to put something healthier in our mouth. So are bananas unhealthy? Well, I mean, do you live on a planet without blueberries? Okay. It's stuff like, we can always kind of ratchet, our health up by, choosing the healthier choices whenever we have a chance. And so if you are privileged enough to have that kind of choice in your life, well then, oh, wow, well, you can get the no salt added beans rather than the regular salty beans. Now beans are healthy, salted or not, but so much healthier, particularly since sodium intake is the number one dietary risk factor for death on planet Earth, excess sodium. We really do want to cut down on sodium, but it's all about just rationing up. We can all just choose to, try to think of how can I make this meal even healthier than it already is.
Okay, I have so many fun follow-up questions, but you've talked a little bit about blueberries better than bananas, etc. If you were going to give people 5 foods that are like, these are, I don't have a swap for them, just great. I'm curious what your top 5 would be. Sounds like berries, dark leafy greens.
You're making me hungry.
All right, what are the next 3?
Okay, so if there were 3 foods to add someone's diet, regardless of what you else do with your diet, it would be berries, greens, particularly dark green cruciferous veggies like kale, collard greens, and number 3 would be legumes, beans, peas, chickpeas, and lentils. That is the primary protein source with all the blue zones center their diets around. We can talk about beans forever. And if there were just 3 foods to first remove from one's diet, Number one would be anything with hydrogenated oils, these added trans fats. Number two would be processed meat, bacon, ham, hot dogs, lunch meat, which is according to the IARC, the official World Health Organization body that determines what is and is not cancer causing. Is determined they're class 1 carcinogens, meaning we know they cause cancer in human beings. Yet we send our kids to the school with bologna sandwiches. We wouldn't smoke around our kids, but what are we doing? And number three would be liquid candy, soda, sugar sweetened beverages. Those would be the three things I would remove. Those would be three things to add. And just doing that, you would be so far down along the path. And yes, if you want to keep tweaking the edges, there's all sorts of things. I mean, God, my latest book at 13,000 citations, you can go as deep as you want to get into the weeds, right?
Sure.
But it's important to take a step back and just some of the really basics. 5 servings of fruits and vegetables a day, maintaining a healthy weight, not smoking, walking even 20 minutes a day. I mean, that's like 80% of the way there.
Sure.
And so if you just, there's this tendency within the public health community to not tell people the truth because I think it's overwhelming. So that's why, for example, the physical activity guidelines come out to be about 22 minutes a day of moderate intensity activity. Now, does the science show that the optimal amount of exercise is 22 minutes a day? No, not even close.
Yeah, we've done this research. It's way higher than that, but they thought that if you said an hour, people would do nothing.
Exactly.
And if you say 22 minutes, they're like, okay, I can do that.
Right. And so actually the evidence peaks out at 90 minutes a day. And the only reason perhaps that it's because they couldn't find enough people to actually exercise more than 90 minutes a day. So it's possible it drops off or it keeps going up, right? But we have evidence at least, walking 90 minutes a day, you associate with longer life compared to 60 minutes, compared to 45, compared to 30. Okay. Now, the important message, any exercise is better than none, right? And so as long as we tell people that, then I'm all for giving people the truth, right? They're afraid people are going to throw up their hands and not do anything. But just hammer that message, any exercise better than none. And then, yes, if you're interested, here's the data showing, more is better. And, there's easy ways to do it and fun ways and blah, blah, blah. And so the same thing with diet. There's that tendency to be like, well, look, let's not, how many people are going to, in fact, the DASH diet is a perfect example. DASH diet is probably one of the best studied diets in human history. This is dietary approaches to stop hypertension. This is like the official, American Heart Association recommends it. The federal government recommends it. This is a diet which was designed to lower blood pressure, which is a leading killer because it contributes to strokes and heart disease and kidney failure and all sorts of other things. We really want to keep our blood pressure down. Okay. And so they designed this diet. And so I have a talk talking about how they designed this diet. There's this critical research done by this famous Harvard nutrition professor that showed that, okay, well, really, the ideal diet would be one exclusively centered around plants. And so why didn't the DASH diet? I mean, were they just not aware of this very important research? No, it was designed by that guy. That researcher is the one who came up with the DASH diet, but explicitly said in their design documents that, look,
not realistic.
How many people are going to go on it? We are going to save more lives if we kind of soft pedal the diet, kind of give it, kind of give them, and then we'll save more lives. Now, okay, I understand that kind of logic, but, tell that to the 1,000 American families that lose a loved one every day to high blood pressure. Right. It's like maybe it's time to start telling Americans the truth, which is that, leading cause of death.
Yeah, I feel like we could have an entire podcast dedicated to the psychology of how you take something that is challenging, but of course correct. You do need to be this extreme and make that palatable to people, because that is a challenge totally separate from what is the optimal diet of, how do you get people to adopt that behavior change, which is not trivial.
No. In fact, so if you look at the USPSTF, the guidelines, which is the official body that makes the prevention medicine guidelines, they will say that dietary counseling for obesity is ineffective. And you say, wait a second, diet has nothing to do with obesity? I mean, that's all that, right?
Yeah.
No, they're saying telling people to eat healthier doesn't work. And it's true. The research is you tell people, you randomize people to advice to eat healthier versus not. And guess what? Nothing happens. Why? because they don't comply, right? So without that compliance piece, and so two things can be completely true at the same time, which is okay, here's the healthiest diet, but maybe we don't tell people about it, right? Here's how much to exercise, but maybe we don't tell people about it. I am of the, I want, let's give everybody the truth and tell people that, look, any movement we can make, certainly it's not black or white. It's not what the evidence shows at all. It shows that even these small incremental steps towards a healthier diet, towards healthier eating, toward cutting down on smoking, right? These are beneficial. In fact, there's even the alcohol literature. We have is not all abstention. Some people, you can give people rules, don't drink alone, don't drink hard liquor, and actually you can show some harm reduction using these techniques. It's not all or nothing. It's not black or white. Little steps can go a long way, particularly when you catch people earlier in life and they can turn these into lifelong behaviors.
That doesn't surprise me what you were saying. When I was an undergrad, I worked for a summer at a healthcare consulting firm in Chicago, and my project was trying to understand why people no-showed follow-up appointments after ER visits.
Mm,
So they'd leave the ER, with a follow-up appointment with a specialist and then not show up. And in the top 3 reasons why people don't show up is because they didn't want to get weighed. And it was like people are in such deep denial about
yeah,
like their weight
right,
and like what that has to do with why they're not feeling well and
right.
like what landed them in the ERs. These are literally people who are, acutely unwell and they're just like, well, never mind because like I don't want to face this. And so it is such a deep issue and like there's so many layers to solving this and obviously your work trying to understand what healthy looks like and how to solve the problem is so important, but there's so many layers we need to understand too and help people like across those barriers. And so I think it is so interesting to think about how do we make you hear the truth and not sugarcoat things because that doesn't really help people, but also how do we not scare you away because if you tell somebody who loves their meat and potatoes, like that's killing them. I think there's a lot of like, psh. And you and I have heard some of these talks around things like, I thought I could just outrun my bad diet, or I
Mm,
thought I
right.
could, do all these different things. And why isn't that true? Why can't I outrun a crappy diet and make up for my crappy diet with other good behaviors?
Oh, because sedentary activity, I think it's in my talk. I think it's killer number 6 falls, or killer number 8, so falls down. So so number 1 is diet, number 2 smoking. So number of risk factors is way more important. Now, I mean, there's overwhelming evidence for the benefits of exercise on down the list, not just on balance and strength training and all the typical things, but with sleep and depression and on down the list. Um, but but there's just you think, I mean, most of our cells in our body are replaced approximately every year, and it's like, okay, what are we building our body with? Over the next year. And our body's big, we are, we eat. It's really food, water, light, air. Like there's not many ingredients that go into our body. And so it's like, well, no wonder if we're choosing like shoddy building materials at the drive-through that we're going to end up with not the optimal working system. People spend more money taking care of their car or taking care, right? They take more care to put in like the high grade gasoline into their, and it's like, you could get another car. If it breaks down, you could just like scrap it, get a whole brand. But but yet they treat their bodies in a way. Now maybe they're going to think there's some biotech revolution around the corner. We're going to be able to just swap them in and out. But right now, as things stand, we really have to take care of ourselves because there's really no good replacement. And, earlier the better. I talk about how, our leading killers like heart disease, for example, by age 10, nearly all kids, even the standard American diet, already have what I call fatty streaks building up inside of their arteries. The first stage of atherosclerotic heart disease, which is going to kill people. You do autopsy studies of young men, women, accident victims, and you see, breast tumors or prostate tumors, and it's like this thought of like using diet and exercise to prevent disease. Well, wait a second. If the average, breast cancer takes 30 years to manifest from the first mutated cell to something you actually pick up on mammography, well, then that 30-year period, and then all of a sudden you picked up on mammography and like, okay, now I'm using diet
Mhm.
to, yesterday I was using it to prevent disease. Now I'm using it to treat disease. No, for the last 30 years, you thought you were eating healthier to prevent your breast cancer. No, you were treating it by slowing down its growth rate. And that's with, we all, whether you know it or not, almost every American raised on a standard American diet has heart disease, has atherosclerotic plaque in their arteries right now. And so, people look at like the great, Dean Ornish lifestyle heart trial, 1990, proving we can actually reverse the progression of heart disease with a healthy enough diet. Yes, that's if we catch it in time. The number one way people die with heart disease in this country is what's called sudden cardiac death, meaning these are people with undiagnosed heart disease. They have no idea they have heart disease, and it's death within a certain number of minutes within after their first symptom. And so it's like a little over 50%, particularly for women, actually. So you don't even know you have heart disease. So, so an ounce of prevention is worth way more than a pound of cure, because there is no cure for dead. Your first symptom may be your last. So we have to start now. The problem with prevention is when it works, nothing happens. Like, it's just such an unsexy, hard to fund anything, kind of motivate people around it. But we only have one life to live.
So I love this. It's such a beautiful metaphor that like eating a crappy diet is like trying to build your house with rusty nails and then like wondering why it doesn't last as long as one that's built with higher quality nails. And so it's important to build our bodies, which we are constantly doing, even if we're quote unquote fully grown. And so we need to put in the good stuff. I think this is probably a softball, but I'm curious how you're going to answer it. If I'm eating crappy food or if I'm eating good food, it all kind of breaks down into the same stuff. You're saying no, I see you shaking your head. What's actually happening, like on a cellular level, when good stuff versus bad stuff comes in? Like I understand the metaphor at a high level, but if I'm getting my vitamins, I'm getting my protein, I'm getting my carbs, you look like I'm saying total nonsense. So let's correct this message, because I think this is how a lot of people think about it,
Yeah.
right? They think in terms of macros, they think in terms of calories. They took their multivitamin this morning. So, buzz off with your superfoods because like I'm hitting all my things.
That you just described the entire field of nutrition dietetics, which was built a century ago based on nutrient deficiency diseases. And indeed, people used to die by the hundreds of thousands of beriberi, because we refined brown rice to white rice, and oops, we didn't know there was such a thing as this particular B vitamin, and literally more people were dying of beriberi in Japan than smallpox. It was the leading killer. Hundreds of thousands of people dropped dead. Scurvy, pellagra, kwashiorkor. These are classic nutrition deficiency diseases. How many people do you know are dying from pellagra these days? I mean, how many of your close friends? Okay, let's ask that same question. How many people do you know? Have you ever heard of this really esoteric disease called heart disease, or high blood pressure, or diabetes, or obesity? Or have you ever? Okay, we are dying of diseases of excess, nutrient excess. I hate to even call them nutrients, technically are, right? Sodium is a nutrient, saturated fat is a nutrient. Okay, so we went from the field. So the field of nutrition was built very powerfully on diseases of deprivation. And in fact, you have the USDA talking about how sugar is the cheapest source of calories. Like, they were touting sugar because for 3 cents, you could get, 2,000 calories. So if you're a bricklayer, like if you wanted to, right? Because we evolved in a context of caloric scarcity, of sodium scarcity, so we grew these tastes for calorically dense foods, fatty, sugary foods, a taste for salt, a taste for, right? And then the food industry took those tastes and used our natural biological urges to hook them into eating not just one of their crazy ultra-processed junk food, which is now killing people with excess nutrients, excess sodium, excess saturated fat, excess sugar. That's what's killing people now. And so the question we should all be asking from a nutritional standpoint these days is not, oh, where am I going to get my riboflavin? The question is like, okay, where am I going to get my potassium? 98% of Americans eat potassium deficient diets, don't even reach the recommended minimum daily intake, 4,700 milligrams, right? And we evolved getting probably over 10,000, right? Okay. 90. So, okay, now that's a nutrient we need to figure out where we're going to get. How, on the flip side, 97% of Americans eat enough protein. Yet what is just like, that's just advertised and everything. These protein, whatever, right? But wait a second. Odds, and the 3% who aren't getting enough protein probably on starvation diets, not eating enough of anything, right? I mean, it's hard. Okay. So 97% of Americans eat fiber deficient diets, don't even reach the measly recommended daily intake. So it's like, okay, it's like, wow, where are you going to get your potassium from? Where did you get your fiber from these days? Oh, wow, I got to eat more whole grains. I got to eat more, right? And so that's really what we have to worry about, not getting enough. Almost everyone gets too much sodium, right? The American Heart Association, 1,500 milligrams of sodium a day maximum. You throw that all into your favorite little nutrient profile website. You put your daily diet and you try to hit 1,500. That's basically eliminating everything in a box or a bag, all processed foods, right? Not adding salt, right? Oh, and then you can, and that's like the recommended, like, so, I mean, so it's, how am I going to avoid these nutrients of excess? Since that we're dying of diseases of excess, that's really where it has to turn to. And so it's like, wow, how much added sugar does this have? Whoa, how much sodium does this have? Right? And since approximately the number of calories we get every day approximates the number of sodium we're not supposed to exceed. So the dietary guidelines say don't go above 2,300 milligrams of sodium. It's about what people eat every day. So you want to make sure every single food has more calories than it has sodium. Because if everything you eat has more calories than sodium, then you're not going to exceed your sodium recommendations. So those are the kind of things we have to worry about. We don't have to worry about, and that vitamin, there's a licensing effect to multivitamins. So you give someone a multivitamin and then you give them a buffet and they choose less healthy choices. Now, a lot of that research, there's kind of a replication crisis, and we're not sure how much of that is actually going to replicate. But there are studies published in peer-reviewed medical literature. You give someone a multivitamin, and it's actually not even, it's a placebo, but it's labeled a multivitamin, and they go on with hidden cameras to eat more chocolate pudding at that buffet. Is because, I did something good, so I can kind of let myself go a little bit. And so that's why sometimes multivitamins worse than useless, right? I mean, it can actually, if it gives you, and you say the thing about statin drugs, these cholesterol lowering drugs, which are amazingly effective, save hundreds of thousands of lives, but on an individual basis, the absolute risk reduction is minuscule, right? So the number needed to treat, you actually ask people what kind of level of protection they needed to take a drug every day for the rest of their life. Even the side effects are minimal, and it's orders of magnitude higher than the actual benefit of these kind of lifestyle drugs. And so if people actually knew, we overestimate the power of pills and procedures to actually keep us healthy when it's really all about these diet and lifestyle. If people really knew how powerful a tool they had at their disposal, then maybe they'd do better and live longer.
So to sum up a little bit of that, what role, if any, do you recommend supplements play? Do you think that they can be helpful for people not in any kind of specific situation, like they're known to be vitamin D deficient or something?
Oh, yeah. No, so certainly there are entire classes. So pregnant women, alcoholics, there's a lot of people where we just know that they're going to run into baseline deficiencies. Certain types of bariatric surgery can lead to very predictable nutrient deficiencies over time. And so there's certain classes of people that need to get specific supplements. If you don't get adequate sun exposure, if you live at a certain latitude, et cetera, you may need vitamin D, the sunshine vitamin, which is not really a vitamin, right? It's a hormone our body makes when exposed to sunlight. And if you're eating an exceptionally healthy diet, one almost exclusively on plants, you need a source of vitamin B12, critically important. I mean, so there's, kind of for different reasons. I encourage people to consider a 250 milligrams of DHA, and a pollutant-free source of DHA, like an algae-based, which is long-chain omega-3 fatty acid, associated with improved cognitive function later in life. You can actually do randomized double-blind placebo-controlled trials and actually improve cognition, reduce brain shrinkage by randomizing people with average kind of long-chain omega-3 levels to 250 milligrams of algae-based DHA. You actually get improvements in cognition. Whether you could argue those aren't really noticeable, and it's more kind of doing tests on a computer, but these are relatively short term. So if you can show actually significant improvements in brain function with 6 months or a year, well, maybe over time. And so I'm convinced by that body of research. I have a bunch of videos, and people may look at the same data and think otherwise. But that's another nutrient to consider, kind of on a general basis.
Now, you talk on your podcast a lot about different kinds of supplements that are common, and a common conclusion is this is actually junk. And so I'm curious, there's probably a lot of people listening who are taking a lot of different things, especially maybe some of the trendy things, the green powders, the whatever. What advice would you give to somebody who hasn't been specifically diagnosed or told by a physician, you're at risk, therefore, or you're pregnant, therefore, take your folic acid, but is just sort of trying to biohack and, is taking 50 things. I mean, kind of famously, you have people like Brian Johnson who takes like 100 pills a day. Like, is there wisdom there? How do you think about that stuff?
Well, so first of all, is the supplement industry so poorly regulated on purpose by the industry? I mean, they've been very powerful lobbyists to make sure that their industry is the wild, wild west, that you can't even be certain that what's in the pill is actually what's on the label. And so you can do this. You can pick your favorite supplement and type that into PubMed, which is the National Library of Medicine, largest medical database in the world, and there'll likely be a study where they just took they either top 15 sellers on Amazon, or they just went to their kind of local health food store or whatever and bought the whatever brands they could find, some convenient sample, and they just tested it. And sometimes not only is there nothing in it, but it's like made of like house plants, or it's just like, or even worse, it's actually contaminated with actual
metals.
pharmaceuticals, or even banned pharmaceuticals, particularly a lot of these kind of like performance enhancing or sexual enhancing. They're actually like these banned drugs, these horse tranquilizers, it's like, so you can't even be certain, even if, for example, taking this much of magnesium had this specific effect, and we actually were confident, that you have no idea if your magnesium pill is even, so one recommendation is that you can buy brands that have been UPC certified, which is a third-party independent certifier, where brands will pay extra money to have that, and then they get a stamp approval. Now, this doesn't mean that the supplement's good for you, right? It just means that what's on the label is within a 10% margin or something of what's actually in the pill. So then at least you know what you're taking. And so that's one way to kind of quality control. Another thing, instead of like taking like a curcumin supplement, which involves someone taking turmeric, the whole food spice, and then extracting out the curcumin, that yellow pigment, which is purported to have some of the anti-inflammatory effects. And so so you are relying on that manufacturer, that they actually did it right, and that they say, and that they're not just putting lead chromate to make it nice and bright yellow, and right. Instead, you can just get turmeric. One ingredient, turmeric, is not an extract, right? And you can get, the curcumin that way, in the kind of way nature intended, and way actually many of these studies are based on. And so, if your green powder literally is like dehydrated spinach, like freeze-dried spinach powder, okay, great, I love it, right? But if it's like, but you can't make a lot of money selling people Whole Foods. Like, why am I paying so much money for whatever for turmeric in a capsule? But if it's like fancy extract turmeric with all sorts of fancy things added, right? Then I'll pay $20 a bottle. It's like calcium, right? Calcium carbonate, that's chalk. So the cheapest substance ever. So you can't sell people calcium and make any money, but you can sell people coral calcium or fancy Himalayan calcium or what, so that you make up some crazy stuff, right? And so oftentimes, so there's a for-profit entity called Consumers Lab that does a lot of testing of supplements. And what they'll often find is that some of the cheapest supplements are actually the ones that are, that actually contain what they say they contain, typically because they're part of some brand like Kirkland or something, which has like a brand reputation to uphold. So they can just put crazy crap in it and hope to get away with it. Now, that's not always the case. But, otherwise you may just get some fly-by-night internet company that's stuffing God knows what in those capsules, and they'll never be caught. In fact, when even the FDA has these like takedown orders because they found some illegal drug in it, then when they go back 6 months later to look at the same brand, it's back. Like, it's like so crazy. It's so frustrating, right? And so ideal. But if you go, if you get your chamomile not in pill form but in flower form, like, okay, maybe this actually isn't. Maybe I'm not a good enough botanist to tell these little yellow flowers really are. But there's probably a better chance that you're actually getting chamomile than if you're just getting like a pill that's labeled chamomile extract, whatever. And there really are kind of pharmacological effects with some of these spices like turmeric and black cumin and papali and hibiscus tea, and like culinary doses of regular spices like cumin can actually have beneficial effects. And we just hope it's not tainted with heavy metals.
So years ago, I did all my thesis work on the effect of melatonin on like circadian phase shifting, and kind of created one of the first mathematical models for
Nice.
that system. And doing that, learned that melatonin supplements, like all supplements, are regarded by the FDA as food and not as medication, which is what you're talking about. This idea that the FDA is not in certifying something saying that this is efficacious at all, the way they would if it was, a Tylenol or something. All they're saying is that it's safe to eat. And so safe to eat does not mean it has the ingredients you expect it to have, or that it's in any kind of bioavailable form. And so what we see with like on-the-shelf melatonin products is that one, they vary tremendously, like you said, from what they claim to, and many of them like don't necessarily actually turn into like bioavailable melatonin that affects how you sleep. And so I think there's a really concrete, useful nugget for our listeners to take away from what you're saying, which is you kind of be careful and look for reputable brands, not to get the cheap stuff and say, well, all these bottles say that they have, X milligrams of whatever substance, so I might as well get the cheapest one, and specifically to look for that UPC seal. So I think that's a really great nugget for people to take away. So thank you for that. As we wrap up, I'm curious if there were 2 or 3 things that you, either summarizing what you've said or something you haven't had a chance to say yet on this podcast, but that you really wish people understood and that they could relatively easily incorporate into their lives, what would those 2-3 takeaways be?
And just wrapping up the supplement conversation, I think, the pushback you get from industry is like, they're trying to take your vitamin C away. No, we're just wanted, as you said, like Tylenol. Over-the-counter medication has to actually, by law, contain what it says it does. What a concept! Mind-blowing. That's all we're asking, is for supplements to be treated like over-the-counter. Anyone can buy them. You don't need a doctor's prescription or anything. If you want to buy it, you can buy it. But it's like a truth in advertising. It actually has to say what it has. That shouldn't be too much. But that is a hot potato in the Beltway. Because there's just such a powerful industry that wants to make sure that they can make money off of suckers. But in terms of what we put in our mouth is most important. Number 1, diet. Number 2, cigarettes. basic, simple lifestyle behaviors are really what's will get people most of the way there. Never too late to stop smoking, never too late to start moving, never too late to start eating healthier. Small changes can make a big effect in the long run. In fact, one of the speakers today was talking about Columbus Batiste, talking about kind of compound interest. You know how that's such a I don't know why everyone didn't think about that before. I'm certainly guilty of not thinking about it, but it's so true. Making those early changes, right, really compounds over time. It's never too late, right? But you change he was talking about the one health modeling study that shows that if you change your diet, and it's really not much, but from a typical diet to a healthier diet, not even a great diet, but a healthier diet, starting at age 20, increases the lifespan of women by about 11 years, men by 13 years. Starting at age 60, though, then you only add 8 or 9 years. But even at age 80, you can add 3 years. So it's never too late. But, the earlier you get on board, the greater chance you have of the benefit.
Yeah, and I think it's not just about longevity; it's quality of life. I think one of the things that's so beautiful about adopting a plant-based diet is within a few days you should feel better. And so, there's the long-term play, but you do get the benefits in the moment. It's not just the compound interest of saving up for retirement.
That's certainly helping. So that's what I've used in my clinical practice a lot. Is this kind of like try it like a free sample? Like let's just you can eat anything for the problem. People can't wrap their heads around. Wait a second, I'm not going to eat pepperoni pizza for the rest of my life. What? They don't even want. They shut it down. Okay, no. 2 weeks. You could eat anything for 2 weeks. You could eat nothing for 2 weeks. Like, all right, let's do an experiment. Let's just give it a try, right? And the reason that the sneaky approach, and look, we're going to give it a try. Might as well jump all in, right? Go all in and do all these things, and then the hope is that within 2 weeks, they're feeling so much better energy, better digestion, less painful periods, whatever it is, then it's like their own body is telling them how much better this diet is. Now, they could still choose to, go back to whatever, but then at least they have that in their mind. That it's not just, but their own body's telling them. And it's that early feedback that's hopefully going to keep people on the path. Not that they're actually going to get benefits in 2 weeks, but the long-term benefits we really care about, but they'll get enough just to keep them on the path. And then, it doesn't matter what you eat today, tomorrow, next week, but for the next couple decades. And so the hope is to, tweak your diet so you'll get those long-term benefits in terms of decreasing disability and mortality risk and all that vitality and mental health and, that we're hoping to get along with it.
I love that. So I wonder if you would agree with this if we want to leave our listeners with the challenge to give plant-based a try for 2 weeks. And if they do that, what can they expect to experience at the end of 2 weeks?
One thing they'll experience is actually a change in their palate. And so taste buds only last about 3 weeks before they're replaced. The original studies were done on low sodium diets. You take people and you remove salt from their diets. And first you have people salt soup to taste. Then you put them on a low salt diet. And at first everything tastes like cardboard. And they're like, oh my God, I'm never going to live my life like this. I don't care if I die tomorrow. There's no way I'm going to live like this. But then something magical happens. Within a few weeks, all of a sudden their palate changes such that the original soup they salted the taste is actually way too salty. They actually prefer less salted soup, right? And so then you get the best of both worlds. Wait a second, healthier and tastes better, right? As soon as we stop numbing our palates with hyper salty, hyper sweet, hyper fatty foods that the processed food industry has been, gearing up. And the animal ag has been, increasing, 100 years ago, chicken was 2% calories. Now it's over 20% calories. I mean, it's all about getting that nice caloric density and such that, the ripest peach in the world is going to taste sour after a bowl of Fruit Loops. Right? I mean, it's just like our palate's completely off, right? But then all of a sudden, something magical happens. Within a few weeks, all of a sudden, you're sitting there eating corn on the cob, no butter, no salt, and it's delicious.
Mm-hmm.
Now, you tell people that now, and they're like, "What? Like that's just like."
Right, like I don't like corn.
Or some will see me. Someone will come by my cubicle, And I'm like, microwave sweet potato, a little cinnamon on or something, and they look at me. I'm like I'm some aesthetic monk. Like, oh, it's great that you can do that, but I could never. That's because they're But if you eat healthy, natural, normal foods for long enough, all of a sudden your palate adjusts, and normal food actually tastes delicious as as the Fruit Loops, right? I mean, it's as sweet, as delicious as it was before. But once you kind of recalibrate your palate, and so then all of a sudden you're not faced. You get the best of both worlds. Tastes great, and you get to live longer too.
Mm-hmm. I love, and I imagine that's new news. It was certainly something I just learned, that our taste buds turn over every 3 weeks. And I think that there's something kind of exciting about that, that if you ride out, maybe where it tastes a little more bland or a little bit less exciting, that you will actually get brand new taste buds, and you get to train them on what food is, all fresh. And so it's not so much that, like, hey, if you wait long enough, you'll forget how delicious Fruit Loops are or
Right,
whatever. But
right,
literally, you can build these brand new taste buds in such a way that they're in tune with what's actually good for
right.
you. And so I think, like, maybe that's where we should end on this beautiful message that, like, give it the 3 weeks, you'll get brand new taste buds, and then teach those new babies to love the stuff that's actually good for you. And so then it's not anymore an exercise about self-denial in service of longevity. It's actually about enjoying the things that are great for you, and longevity is just this delightful side effect.
Love the food that loves you back.
I love that. Thank you so much for being here with me today. I had so much fun, and I learned a lot talking to you, and I hope you had a great time too.
Absolutely. Can't wait to come back.